become harder and harder for healthcare workers to uphold their Hippocratic oath. And as thousands of doctors and nurses fall prey to the vicious COVID-19, while countless infected people are flocking into infested hospitals, lots of seniors are wondering, am I pushing my luck? It's something that prompted the CDC at the height of the first wave to advise older folks with chronic conditions to stay at home as much as possible. It seems as though millions of Americans with diabetes, heart disease, or any other chronic health problems are now between a rock and a hard spot. It's a deadly dilemma. If you're not feeling well, you need immediate medical help or risk getting sicker. But if you do go to the hospital, you face the risk of getting COVID-19 from another patient who doesn't even know they have it, or worse yet, from the very doctor or nurse who is supposed to take care of you. If this scenario frightens you, don't worry, you're no coward. It just means you're smart enough to understand the risks, and these risks are very real. In fact, the CDC reported that over 62,000 health professionals got infected through May 26th, and numbers only went up from there. We know for a fact that hospitals are a major source of COVID-19 infection. In the UK, up to 20% of all infections happened in the hospital while people were getting treated for something else. And even though the U.S. authorities haven't been too transparent with these numbers, we know that at least 9,000 Americans came back home from hospitals with the bug. The real numbers are likely much higher. But amid this unmitigated disaster, there is a ray of hope. And it's coming from the same place that made this country the best in the world. American self-reliance. Because while the most dangerous pandemic in over a century is raging on, tens of thousands of patriots have started taking matters into their own hands. And they're staying healthy and safe even when there's no doctor, or at least until they can safely go to a hospital. Hi, my name is George, and in this video that I might be forced to pull down from the internet soon, I am going to show you why, if you've been postponing going to the hospital for anything non-essential, you might be right, and why soon enough there might not be a doctor available even if you need one. I'll explain exactly what medicine this battle-hardened surgeon from Europe recommends you stockpile right now to prepare for the looming drug shortages. I'll show you how to get a list of all the natural remedies you need to hoard for long-time survival, and what are the simple yet essential medical techniques and procedures you need to know in a medical emergency, so that even if there's no doctor or you can't visit one, you can still manage your chronic conditions, reduce your pain, and even restore your health until the doctor can see you. This is especially important if you or a family member are at risk. According to the CDC, 8 out of 10 COVID-19 deaths were from people over 65. No wonder I'm taking this more seriously than anything, huh? Like I said, my name is George, and I am from Survivopedia.com, one of the leading survival websites on the internet. Odds are you don't know about us. Many people don't. In good times, people hate us for being wrong and for somehow spreading fear. In bad times like these, we are hated for being right. You just can't win with these guys. I've heard it all, that I'm a conspiracy theorist, a tinfoil hat, crazy prepper, you name it. But over time, I learned to stop paying attention to the trolls and the internet idiots, and I realized that we were not alone. We published Backyard Liberty and showed people how to prepare for a food crisis. More than 140,000 Americans heeded our calls. Even more were interested in our EMP preparedness course. We help patriots prepare for unlikely but devastating events, like the current pandemic. And this time, it's more personal than ever, because you see, I'm one of those seniors with underlying conditions you keep hearing about. My health, maybe like yours, is far from perfect, but I manage. I used to do many stupid things when I was young. We all did, but it doesn't mean we deserve to die. No one does. And frankly, I won't go gently into that good night. Not if I can do something about it. That's why in the early days of the pandemic, I put my nose to the grindstone and spent hundreds of hours researching this novel threat. And what I discovered shocked me to the core. Hard evidence that we were about to witness a healthcare apocalypse of biblical proportions, and not directly from COVID-19, but from its consequences. Big words, I know, and I double-checked the evidence and hope I was mistaken. But I'll show you all my proof here, so you can either prove me wrong or realize that time to prepare is right now while there's still time. The numbers don't lie. Millions of Americans have already opted out of the healthcare system. Hospital visits were down nearly 55% in March and April in an analysis by Strata Decision Technology. People are getting it. In the middle of a pandemic, the last place where you want to be is a building where all the sick people go. Because frankly, it doesn't take much to get infected in a hospital. Hospitals are notorious for making people sick, even without a pandemic. The CDC estimates roughly 1.7 million hospital-associated infections that cause or contribute to 99,000 deaths each year. And that's even before the coronavirus. COVID-19 makes this much worse. People don't realize just how easy it is for a nosocomial outbreak to happen, that is, for your hospital to infect you. A recent Harvard Medical School study puts it this way. To cause a nosocomial outbreak, it will take just one patient with occult COVID-19 who is hospitalized, tests negative for influenza virus, and is taken off precautions despite persistent respiratory symptoms. Or just one visitor with COVID-19 and mild respiratory symptoms who is permitted free access to the hospital because it does not have an active screening and exclusion policy for visitors with respiratory tract symptoms. Or just one infected healthcare worker who decides to soldier through a shift despite a sore throat and runny nose. But there's another side to this story that should give you the jitters, because soon you may discover that you can't go to your hospital because it doesn't exist anymore. Now, okay, this might sound crazy, but it's 100% true. As expensive as healthcare is in the U.S., people don't realize just how fragile hospitals are, and many of them are laying off personnel at an unprecedented scale, or they're even going bankrupt. You see, during the pandemic, hospitals were forced to halt elective surgery, which accounts for a big chunk of their revenues. With elective surgery gone, their revenues dried up. How much? Well, a whopping $200 billion with a capital B, and these numbers are June numbers. It's enough to send many hospitals to the brink of financial ruin and beyond. We've already had 29 hospital bankruptcies in 2020, but that's just the tip of the iceberg, especially for rural hospitals. Michael Topchik, Executive Director of the Chartis Center for Rural Health, says that 453 of the country's 2,000 rural hospitals, close to 1 in 4, are in danger of closing, while 216 are most vulnerable. Not even the giants are faring better. Mayo Clinic is expected to lose at least $3 billion in revenue this year and has already undergone pay cuts and layoffs. If Mayo Clinic is in bad shape, you can imagine just how much worse the smaller hospitals are doing. But wait, there's more, because simply avoiding doctors and hospitals is not going to cut it. In fact, it might make things worse. In fact, if that's your plan, maybe you're better off playing the COVID-19 lottery and just going to the hospital, because doing nothing is not much of a strategy, and people have started paying with their lives. Now, it's true. Stats are showing a sharp increase in heart attacks and stroke, with at least 35% of the excess deaths not caused by the coronavirus. Take D.C., for example. According to the D.C. Health Director, excess deaths in the state were 40% higher from January to May than they were just 1 year before, and almost half of those were not attributed to the novel virus, instead to conditions like pneumonia, flu, diabetes, cancer, and overdoses. And this begs the question, how will Americans deal with chronic conditions when it's not safe to visit a doctor? How will the millions that suffer from heart conditions, diabetes, kidney disease, or COPD, where will they go when their hospital is closed? What will they do if or when there isn't enough medical personnel to take care of them? It's the deadly dilemma. Go to the hospital and risk getting sick, or stay home and risk getting sicker. Well, there is a third way, the very thing that helped make America the greatest country in the world. Self-sufficiency, and I'll show you how becoming medically self-sufficient will help you slash your risks of getting sick and keep your health in the best shape you could hope for, even if the pandemic decides to stay with us for a long time. So what can you start doing right away to become medically self-reliant? Well, there are 2 simple steps. Step 1 is to start stockpiling essential medication that might be gone in a crisis. Studies have shown that there are 153 critical drugs that people with chronic disease need right now, or else they will die. Many of them are made in China or in India. We were already experiencing shortages even without a pandemic. With so many factories closed and governments limiting exports, you need to brace yourself for possible worldwide disruptions. So what medicine to stockpile? I have a special list from a top survival doctor, and I'll share it with you here in this video in just a moment. But that's just the beginning. Step 2, and probably the most important thing, is you need to internalize some basic medical skills that can save your life in a no doctor scenario. Look, knowledge is power, and even the most basic medical knowledge will give you the power to save lives, yours or maybe a family member's. In case you're thinking I'm nuts for even considering that you learn basic medical procedures, I know how it sounds. What I'm saying here is that you'll perform your own surgery? No. That you'll treat some serious health conditions like a stroke or heart attack? No. If any of that happens and there is no doctor, I hope you scored good points with God, because you're going to need all of His goodwill. But just because you won't perform your own brain surgery doesn't mean there aren't things you can do. Quite a lot, actually. You can learn to prepare for nervous, respiratory, circulatory, digestive, and urinary system diseases. You can manage superficial wounds and even fractures. You can give first aid. You can learn to self-diagnose a medical problem, with some help, of course, perform CPR, stop bleeding, deal with trauma, deal with hypothermia and hyperthermia, fight infection, and so much more, all in a few hours of casual reading. How do I know this? Years ago, when the Ebola pandemic happened, I was afraid that it was going to be the one. Luckily, that wasn't the case. But while I was reading every available source and doing my research, talking to doctors, things like that, it occurred to me, not all doctors are alike in a no healthcare situation. As I was doing my Ebola research, it struck me that the best doctor for a medical crisis will probably not be some silk underwear Porsche driving doctor from a billion-dollar hospital. My best bet was someone from the trenches, a doctor who is forced to perform miracles with no expensive, state-of-the-art technology, and while facing severe drug shortages. In short, I needed a third-world doctor. If I wanted to learn from the best, I knew that the best crisis doctor would be someone who fights crisis on a day-to-day basis. And after a few months of research, I found my guy in one of the poorest countries in Europe, Romania. His name is Dr. Radu Scurtu, and he's a rather unusual surgeon. While he's currently working within the state-of-the-art French healthcare system, he earned his stripes in the terrible healthcare system that Romania had in the early 2000s. The doctor had seen it all. No electricity, no proper disinfectants, having to seat 2 patients in the same hospital bed because of shortages, rats and cockroaches, things that would make your stomach turn and that you'd never see in the U.S. under normal conditions. Dr. Scurtu managed to get out of that system, first working for a few years in Germany before moving to France, but he took with him a wealth of information on how to deal with a collapsed system. What's more, moving from Stone Age to state-of-the-art meant he could get the best of both worlds. Romania had taught him self-reliance and ingenuity. Western Europe provided the expensive toys. It reminded me of a lesson I learned from my grandpa, a self-made millionaire, but who had weathered 2 wars and the Great Depression. While Grandpa was happy to enjoy a life of luxury, he always liked to remind us that it can and will all go away. He had lost it all multiple times and had made it all back in multiples, and with the help of God and his own good attitude, Grandpa was fond of saying,
"There is no education like adversity." Now, when you think about it, it makes sense. Should the healthcare system collapse, most of our fancy pants doctors are going to be screwed. They have no idea what it's like to operate with a flashlight or what to do with a patient when basic medicine is out of stock and the fancy equipment is hogged by thousands upon thousands of sick people. They're just going to be overwhelmed, and we're going to be the ones who will suffer the most. When I met Dr. Scurtu, one of my first questions was, what can I do to fend for myself in a medical crisis? I was expecting, the same run-of-the-mill response I had gotten tens of times from other doctors. Things like, oh, you shouldn't play doctor, that I should go to the hospital, yada, yada, yada. I knew that. I'm not an idiot. But what if there is no doctor and there's no hospital?
Dr. Skirtu was more than happy to take my question, and he gave me an earful. Turns out, short of surgeries and complex medical procedures, there's quite a lot of stuff you can do. Here's some of it, but first, a disclaimer. Don't try any of it without talking to your doctor first. I'm giving this for information purposes only. If you have a doctor you can access, call him. If you can go to a clinic, do that. It's the safest course of action, and it would be irresponsible of me to suggest otherwise. Below you'll discover what a doctor does when they can't go to a hospital. Use your own discretion. Here's what I learned from Dr. Skirtu, that if you want a good chance to treat something properly, you first want to know that you diagnosed it correctly. He taught me the simple T-Cal-Mo-Lo principle. These are the core questions you need to ask to clarify the circumstances in which the injury happened. Temporal, when did the injury occur? Causal, why did it happen? Modal, how did it occur? Location, where did it happen? Ask these 4 questions and you'll have a proper baseline for healing the patient. Beyond that, the doctor showed me how to recognize the signs of medical distress. Is the patient pale? Does he or she have a too weak or too rapid pulse? Are they confused? Are there any obvious signs of injury? The doctor then showed me how to perform a body check, more about this later, and hundreds of little tidbits that could save your life. For example, did you know why it's a good idea to have an old school glass syringe in your house? It's because you can sterilize and safely reuse glass, unlike the disposable syringes. In fact, it's probably a good idea to buy some medical pliers and pinchers to have just in case. I asked Dr. Skirtu what medicine to stockpile in the event that you won't be able to find them in a crisis. This is particularly important now, with global supply chains falling like dominoes. He gave me more than a handful. Let's start with the obvious. What should you have on hand in case of pneumonia? Try to have some Cipro or Avelox around the house. For kids, Bactrim or Suprax suspension will help. Talk to your doctor about extending your prescription. For asthma and breathing problems, see if you can get your hands on prednisone, albuterol, or primatene mist. That's a less effective over-the-counter that contains aerosolized epinephrine. For shortness of breath or chest pain, stock up on nitroglycerin 0.4 milligram tablets as well as anticoagulants. For gastrointestinal problems, make sure you have plenty of fiber laxative, such as prilosec or kaopectate. For non-infectious diarrhea, Imodium AD will help. In case of a urinary tract infection, make sure you have Bactrim or Macrobid. Other things you must have in your stockpile include aspirin as a blood thinner, atherosclerosis medication like Mevacor or Zocor, Coumadin as a blood thinner for stroke, Aleve for arthritis, Lisinopril or Tenormin for high blood pressure. So I knew I had to persuade Dr. Skirtu to share his wisdom with our community. Extracting practical wisdom from survival experts was, after all, our specialty. But the good doctor wasn't interested. He liked his privacy. He didn't like fame of any kind. And for sure, he didn't want any of the negative attention that tends to come with being any kind of a survival expert. It wasn't about the money. The French healthcare system pays doctors handsomely. But I was determined to win this one because I knew it wasn't about our egos. There was much more at stake, the lives of thousands of Americans who would be left helpless in a medical crisis. After a lot of cajoling and maybe a little bit of emotional blackmail, I succeeded, and boy oh boy did we deliver. We interviewed the doctor for 2 weeks straight. What's more, I was too paranoid to let the good doctor write it all by himself. Truth is, as much as I loved his expertise, I was afraid we would end up with a course written for other doctors. Too often, experts suffer from the curse of knowledge. They know the stuff so well that they forget what it was like to not know. So they tend to give really complicated explanations that no one really understands. But that was fine. I knew nothing about how to be your doctor in a crisis. So I asked all the dumb questions, so you won't have to. When I didn't understand something, I asked the doctor to rephrase it in plain English. And when we put it all together, it turned out to be the most practical course on medical preparedness you'll ever find. We called it Survival MD. What to do when there's no doctor. Before I go on and explain what's inside, I want to set the record straight.
Here's what Survival MD is not. First of all, Survival MD is not a medical tome. If you plan on becoming a doctor or a registered nurse, this is not for you. This is a practical, down-to-earth, plain English course on how a layman can replace the doctor when there's no doctor available and you're in a life and death situation. Second of all, it's not a book on how to treat yourself when you can easily go to a doctor. That would be plain stupid, and it would be irresponsible for me to suggest otherwise. If you're looking for a way to stop going to the doctor when there's nothing else wrong in the healthcare system, it's my duty to tell you that you might put your life in serious danger. Third, and frankly, I don't care if this hurts our sales, this is one book I hope you will never, ever need. Just like I hope you'll never have to shoot your gun in self-defense. But it's wise to protect yourself, right?
Si vis pacem parabellum. This is a Latin quote I hold dearly. It means that if you want peace, prepare for war. It's why we keep a big army even though we're not fighting the Nazis anymore. It's why you keep a fire extinguisher in the house. This course is a fire extinguisher. Now, it won't prevent fires, but it might help you put them out. Now that I got all this out of the way, let me tell you why I'm so excited about Survival MD. There's no other medical survival course like this on the planet, and I'm not just using these words lightly. As far as I know, this is the only course of its kind. Something that will allow you to weather out a medical emergency where there is no doctor. It doesn't matter if it's a pandemic, a grid down scenario, or a Katrina-like event that clogged hospitals for weeks. Maybe you're familiar with the 80-20 principle. If not, here's a refresher. 80% of all of our problems come from just 20% of causes. You learn 80% of any topic in about 20% of the time you study. You spend 80% of your time with less than 20% of your friends. Once you understand these universal principles, you'll start seeing it everywhere. It's the same in medicine. Sure, you can go to medical school, pay $250,000 and sink 4 years or more into this, or you can take a shortcut. Learn the 20% of medical knowledge that will help you in 80% of the situations. And this is exactly what Survival MD is about, a layman's shortcut to developing life-saving skills for a crisis. Survival MD has but one purpose, and one purpose only, to keep you and your loved ones alive until a qualified specialist can see you. And in order to do this, we pulled out all the stops. Here's a glimpse of what you'll find inside. Got asthma or COPD? Dr. Skirtu will show you how people with respiratory disease need to prepare. One of the things you'll absolutely need around the house is an oximeter, and 4 other things you need to order online right away. Plus, planning for long-term medical survival? Take care of this first, even if there's nothing wrong with your health. NASA does it to all their astronauts. The doctor will show you what 4 items to stockpile, not medicine, for someone who is wheelchair bound. Plus, what you should do if your MS is exacerbated and there's no doctor. Also, what if you have cardiovascular disease or peripheral vascular disease and the dangerous warning signal that comes from your toes? We'll show you the 2 fruits people with kidney failure must absolutely avoid, at least until a dialysis machine is available. Also, why you should rub clove oil on a sore tooth for relief. And 7 other things you can do to prevent getting a deadly infection when there's no dentist. What to do when there are no antibiotics available. Yes, veterinary antibiotics can help, but how do you know the right dosage? Why Augmentin may be the best antibiotic to stockpile, if you can still find it, and 6 other antibiotics that may save your life from a deadly infection. Number 2 is the best for pneumonia. Does your medical go bag have a fully stocked hygiene kit? 19 things you should hoard. Plus, how to make your own toilet paper, if you run out. This recipe uses baby oil or lotion and will give you a good alternative when panic buying emptied all the store shelves. How to build the ultimate medical go bag. This includes cheap alternatives if stores and pharmacies run out of the essentials. Plus, 8 medical instruments you didn't know you needed, but surgeons keep them in their homes for an emergency. Also included, 9 things to stockpile in your bug-out vehicle. We've included simple and effective first aid techniques you need to learn now, including how to treat a bullet wound. This might come in handy if there's an economic collapse and mass social breakdown. What to do if garbage disposal services stop working. Full list of supplies you need for emergency sanitation. And how to deal with human waste so that it doesn't become a hazard. Did you know you can make your own hand sanitizer that doesn't dry your hands and costs a lot less than the price gouged versions you can find in stores? It's easy. All you need is some aloe vera gel and 99% isopropyl alcohol. You can still buy both online in bulk. Take 1 part aloe vera gel and mix it thoroughly with 2 parts alcohol, and you're set. For a fraction of what you'd have to pay even before the pandemic. That's just one of thousands of life-saving tips you'll discover inside Survival MD. Things like the 4 essential medical skills for the layperson. You'll learn how to treat mild to moderate burns, how to straighten and splint fractures, how to stop moderate bleeding, and how to take care of complex lacerations. the right and simple way to give CPR. It's an easy but effective system called CAB or CAB that stands for Circulation, Airway, and Breathing. You'll also learn basic life support like rescue breathing, chest compressions, and basic first aid. You won't be able to give advanced life support, but basic life support might save a life. How to know within minutes whether your patient is in severe condition or it's only something mild using the Glasgow Coma score. We've also included lots of information that we hope you never need, but that might come in handy in a crisis situation. Things like how to use a defibrillator and read an ECG, how to perform an emergency amputation, how to stop a bleeding in seconds, 5 ways to suture skin so it would heal faster, and so much more. Even if there's a complete shutdown of conventional healthcare, there's still hope, because there are plenty of herbal remedies that will keep you healthier until there's a doctor. For fever, you'll get a doctor's recipe for a mixture of yarrow, peppermint, and elderberry flowers. For pain, you'll get 7 powerful reliefs, and lots of proven remedies for cold and sniffing, sore throat, diarrhea, and constipation, and lots of other health problems. You'll discover the top 5 most likely causes of death you'll be faced with in an aftermath of a crisis. It may sound weird, but focusing on these means you'll ward off up to 80% of the illnesses, so there's no need to fill your brain with medical problems that have a 1 in a million chance of happening. And that's not all. Inside Survival MD, you'll find the worst medical mistakes you can do in a crisis, like, do you know what you should never do if you're stabbed? People in third world countries struggle with this horrifying scenario every day because of the high crime rate. There are 2 key procedures to avoid bleeding to death or even getting an infection. And do you know why you should never use a plastic bag or wet bandage to cover a wound? In fact, doing it increases your risk of infection and even death. You'll learn how to put a dislocated shoulder back in its place, just like the professionals do, and it's easier than you think. You'll also find out how and where to get a few months' worth of prescription drugs, a little-known secret for getting behind-the-counter drugs without a prescription, and life-saving advice for dealing with a whole range of conditions, like heartburn and gastritis, Crohn's disease, ulcerative colitis, IBS, kidney stones, and more. And that's just a taste of what's inside. But wait, there's more. It's essential that you get access to Survival MD right away. We don't know what the future may hold for us, but you need to prepare. And you need to do it now. This is why when you're getting Survival MT today, I want to send you 2 special reports to help you through these hard times. The first one is called The Doctor's Best Practices for Preventing a Coronavirus Infection. Look, even if there's no cure or vaccine for COVID-19 yet, it doesn't mean there isn't a lot you can do to protect yourself from it. We wanted to dispel some of the misinformation surrounding face masks or why washing your hands is not enough. There's one thing most people do to render even the most disciplined hand washing useless. We show you how to practice food safety so that you don't get infected when you shop for food or when you cook it, and how to travel if you absolutely must. We also included 2 essential things doctors do to boost their immunity for the flu season. Number 2, slash people's risk of getting the flu by 5 times. While the coronavirus is not the flu, it's been theorized that it will lower your odds of getting an infection. The second bonus I'd like to send you is something I hope will never happen to you. But if it does, you will need this. It's called How to Survive Isolation and Quarantine. I did this research for myself, and I believe it will help all of us. Soon enough, you might find yourself in quarantine or some form of social isolation, either mandatory or self-imposed. So how do you survive 30 days or more of isolation? Quarantining alone is a different deal than quarantining with others. At the same time, if one family member is sick but the others aren't, it's going to be really tricky to isolate just the sick person. All these things bring up some interesting issues, like how do you resupply while in quarantine? How do you avoid infecting others? How do you take out the garbage and make sure it doesn't pile up? And many simple things like that most people probably never thought about. You'll get this special report on isolation and quarantine for free when you get the Survival MD manual today. By now you're probably wondering, well, how much will this cost? Look, I won't hide it. This training is one of a kind from one of the only survival doctors in the entire world. You're not going to find something like this anywhere else. I can't stress how much I want things to change, for this information to be something you will never need. But if you've read this much, you probably want to prepare for the unthinkable. The only thing that comes close are medical textbooks. They will give you a world-class training, that is, if you can understand all the scientific jargon and are ready to spend up to $1,400 for a year's manuals. Or you can get Survival MD, the crash course, the express version for laypeople, and pay a fraction of that. You won't become a doctor, but you will be better prepared for a situation where there's no doctor. You can think of this as a form of life insurance. For me, the best life insurance you can get is self-reliance. And I wanted to make it as easy as possible for you to become more self-reliant in this crisis. This is why this is not going to cost a fortune. Plus, I want you to start reading this now, not a week from now. This is why you can get it in print and start reading immediately. Look, this is not some quickly slapped together ebook or some other junk like the stuff ruthless marketers are peddling on the internet. I think that when it hits the fan, it's important to have a hard copy in your hands, something you can use as a reference manual every time you need to. Plus, in a power-out situation, a hard copy might be the only way to use this knowledge. But at the same time, I don't want to rely on the USPS these days. It can take a week to ship the book to you, and I believe you deserve this information now. So here's the deal. For people who are in a hurry and want the information right now, we typically sell a $39 digital-only version of Survival MD. For those who want it in print and can wait up to a week for delivery, we add an extra $8.99 for shipping and handling. But today, I want you to get both the physical and the digital, and you only pay for the printed version. This way you can start reading immediately and still have a hard copy for reference in your library. And frankly, the price doesn't even matter. That's because you're covered by our 60-day ironclad money-back guarantee. Here's how it works. There's so much chaos and uncertainty these days that I want to help you get some peace of mind. You'll get Survival MD and all the bonuses right away, so you can study it and use its wisdom immediately without wasting precious time. I hope it will ease your anxiety and help you feel like you're gaining control over your health and your life. Preparing for a medical emergency is one of the most important things you did in your entire life, and I want you to feel there's no risk. I believe so much in Survival MD that if you think it's not worth 10 times what you paid, you owe us nothing. Just send it back and we'll reverse the transaction instantly so you'll get every penny back. On top of that, and maybe I shouldn't even say this, since this is a digital download, you can keep all of it just for giving it a try. Even if you decide it was not for you and you want your money back. Scout's honor. So go on, click the Add to Cart button now and try Survival MD today, knowing that you risk nothing. In this video, I've shown you why millions of Americans are right to avoid non-urgent hospital visits in the middle of an outbreak. People can and have gotten infected in hospital. But I've also shown you that avoiding the doctor only sweeps under the rug, delaying and sometimes increasing your risks. You've seen how there's another way for patriots to stay healthy when there's no doctor. And hopefully I've made a good enough case for why you need to learn some basic but essential medical skills to save you in a potentially life-threatening situation when there's no doctor around. I don't think there's a better teacher for all of this than Dr. Radu Skurtu. He's proven his resilience in the trenches of the least funded European healthcare systems, and he's had his fair share of modern healthcare. He's the only survival doctor that I would trust my life with. Now, it's up to you. And frankly, time may wait for others, but it may not wait for this pandemic. I hope there will be a vaccine soon, but I'm not counting on it. Remember how the war in Afghanistan was supposed to last less than a year? Well, my hopes aren't high with the pandemic either. And the truth is, we're not more prepared than we were when this started. I fully expect to see more hospitals shutting down, more people getting sick from hospital-acquired infections, and even more people deciding it's not worth playing the odds and going to the doctor. This is why getting Survival MD might just be the best investment you make this year. Remember, we'll also send you the 2 special reports, the doctor's best practices for preventing a coronavirus infection and how to survive isolation and quarantine free of charge. So I urge you to click the Add to Cart button now and thank yourself later, after all this is over, for making one of the best decisions of your lifetime. Remember, you risk nothing. You're backed by our 60-day, no questions asked guarantee.